slide. Excellent. Thank you all so much for joining us. My name is Victoria Kelly. I am the Senior Manager of Advancement and Strategy with the Homeless Leadership Alliance of Pinellas. And I thank you all for joining us for the first information session of 2025. We started doing these info sessions really last year as an opportunity to just provide more information about resources that are available within our community, because resources are only really helping the community if people know that they're there and know how to access them. So we are hoping that everybody here will learn how to access these really important resources, or how to help friends or family or clients access these resources. Because when we all have access to support and services and shelter, our entire community is healthier and happier and thrives. So thank you all for being a part of that. Tonight, we will hear from our team at the HLA to learn about coordinated entry, which is that front door system here in Pinellas County. Then we'll also learn about emergency shelter from Lieutenant Zach H. with Safe Harbor. And then we'll hear about street outreach, which is a really cool program that a lot of municipalities and organizations offer here in Pinellas County. And so we will hear from an actually nationally recognized program. Mr. Todd Nutbrown from the City of Largo is going to join us. And then Mr. John Paul from Metropolitan Ministries is also going to talk a little bit about street outreach. Really excited about that. And then last but certainly not least, we are going to hear from First Contact. You might also know them as 211 Tampa Bay Cares, who are going to talk about the homeless helpline and additional resources and referral sources here within Pinellas County. There will be an opportunity to ask questions after everybody presents. So we're going to have 15 minutes for presentations, and then everybody's going to have an opportunity to ask questions afterwards. So if you have questions, please drop them in the Q&A box. You can put them in the chat too, but we might miss them if they're in the chat. If you put them in the Q&A box, we'll definitely see them. And so there will be an opportunity to ask questions or give feedback. There may also be an opportunity to ask one or two questions after each presenter. We'll just have to see how time works. And then at the very end, like I said, you'll have an opportunity to share some resources or some information as well for the good of the group. But never hesitate to drop that information in the chat so that everybody can get it along the way. Before we jump into our first presentation, I also want to introduce you to my new boss, HLA's new CEO, interim CEO, Ms. Sherry Holtzbacher, who joined our team back in June or July of last year as our Director of Quality and Performance Improvement, and has taken on the role of interim CEO. And I'm just going to go ahead and speak for our entire team when I say I'm really excited that Sherry has taken this role on, and I'm really excited that y'all get to meet her now. So Sherry, you want to say hello?
Yes, thanks, Victoria. Good afternoon, everyone. I just, like Victoria said, I recently stepped into the interim CE role for HLA, and because there's such a beefy agenda here, going to keep this very quick, just so you had a face to the name, and look forward to working with you in the future and seeing you at future events. I will be popping my contact information into the chat so that if anyone wants to reach out to me, please feel free anytime. Thank you. Back to
Thank
Victoria.
Thank you so much. Without further ado, I'm going to pass it along to Ms. Suzanne Boylan, who is the Senior Manager of Coordinated Entry here with the Homeless Leadership Alliance. Suzanne?
Thank you so much, Victoria. Welcome, everyone. Good evening. I'm so glad for all of you that are on today, and those of you that were not able to join on today. Like Victoria said, this will be recorded. So questions, feel free to ask any questions at the end of our info session. And I believe there might be a Q&A box as well for everyone to plug in your questions so you don't forget. My name is Suzanne Boylan. I'm the Senior Manager of Coordinate Entry. And today I'll be giving you a quick overview of Coordinate Entry, what it is, how it works within our community and our continuum of care, and why it's so important for our community and all communities in general. Again, if you have any questions, don't worry. Also, my contact information will be on the last slide at the end, so you can always reach out to me at any time. All right, let's get started. Thank you. So as I talk about coordinated entry, some of you may not even know what that is. Some of you may know what that is already. Or some of you may have heard that word, right? And really need a little bit more context to what it is that entails, what a coordinated entry system is. So coordinated entry is a system designed to make sure that people experiencing homelessness can get connected to the right housing and support as quickly as possible. So it's a system that helps people find housing and services faster. Instead of people having to call around to different programs on their own, this kind of system makes the process organized and specifically fair. So it's important, coordinated entry is important because homelessness in itself is a very complex issue, and no single program can solve it alone, right? And so that's why coordinated entry exists. Coordinated entry and its system brings together all of those housing services and resources in the community to match people with the best options for their needs. So coordinated entry works in a few different ways. So coordinated entry prioritizes the most vulnerable, right? So people who need the most help get housing and services first, those that are the most vulnerable. Coordinated entry also makes access fair and equal. So everyone experiencing homelessness has the same chance to get help in a fair way. Coordinated entry also prevents people from slipping through those cracks. So instead of getting lost in the system, people are connected directly to support. And coordinated entry uses a housing first approach. So housing first means that people can get housing first without having to meet any extra conditions before getting help. So by working together and making sure resources are used effectively, coordinated entry is that system that helps move those closer to ending homelessness in our community. Next slide. Thank you. So I also want to talk about what makes a strong and fair coordinated entry system. So a system that helps people experiencing homelessness get connected to housing and support as quickly as possible. And that's what makes a strong and fair coordinated entry system. A coordinated entry system has to have a housing first approach, which I had mentioned before. But just to reiterate, it means that we're focusing on getting people into housing first and then providing support to help them stay stable and sustainable with those intensive supports. It also must have fair and consistent decision making. So the same tools and processes must be used for everyone across the system so there's no confusion and everyone is aligned. Also, transparency, right? The process should be very clear. It should be very easy to understand for everyone involved, including service providers and the actual people that we're serving, right? Prioritization over first come, first serve. So we help the people who need it most, the most vulnerable first, right? Rather than just helping whoever asks first. This makes the system fair and ensures that the most vulnerable get help quickly and promptly. A smooth process from start to finish. Coordinated entry guides people from the moment that they ask for help until they move into a safe and stable home. And coordinated entry does entail 4 core elements. And so a strong coordinated entry system is built on those 4 main elements, which we'll go over next in the next upcoming slides. Following these key points that I just went through and these coordinated entry musts, we make sure that housing and services go to those who need them the most quickly, fairly, and efficiently. So finding housing can be overwhelming for anyone, right? Especially people experiencing homelessness. It often feels like a maze with no clear direction, and that's where coordinated entry for individuals and families and those subpopulations in between, such as veterans, etc., come in. So coordinated entry makes the process easier and fair by providing a standardized way to access housing and services. It ensures that everyone gets the right support for both their immediate and long-term needs through a client-centered approach. Before coordinated entry, different service providers use different forms, they use different assessment, and they also use different processes. So that led to inconsistent decisions and a lot of confusion about what housing and services were available within our community. Now, every program that participates in coordinated entry follows standard forms and a shared approach to making decisions. So instead of a scattered system and a complex system, we've streamlined that, right? We have now a coordinated referral process, and that connects people to the right housing and the right support based on their needs. Here in Pinellas County, providers are working together strategically, right, endlessly to better serve individuals and families experiencing homelessness. And we're all using data-driven and evidence-based methods to improve those outcomes and to ensure resources are used effectively amongst all. A strong coordinated entry system is key to reaching the goals of the HEARTH Act, opening doors, which is that federal plan to end homelessness. So that HEARTH Act helps us move away from scattered programs toward a unified approach, and one that quickly matches people to the best available housing and support to help them get back on their feet. So by working together, we can continue building a system that is fair, efficient, and effective in helping people find housing and stability. Next slide. Thank you. So I just want to walk you through those elements of coordinated entry. So those 4 key parts of CE, or coordinated entry. These are the steps that help ensure people experiencing homelessness get connected to the right support. So the 4 core elements are access, assessment, prioritization, and referral. So access is that first step, right? That front door. It's where everything starts. And it's the first point of contact for people facing a housing crisis. It can be through a street outreach team, a shelter, or another community service provider. And the goal is to make sure that everyone has a clear way to get help. And that second element is the assessment piece. So it's understanding what that need is for the person, right? For you, that may have accessed our system to begin with. So once someone reaches out for help, that's that next step. So what assessment means is we're gathering all that important information about your housing situation, your needs, and any barriers that you or the person reaching out might be facing. So the goal is to understand what kind of help you or that person needs and what type of housing support would work best for them. The third element is prioritization, and that's helping those who need it most, the most vulnerable. Because there are limited housing resources, we use prioritization to make sure those who need the most help, the most vulnerable, get assistance first. And this process helps us match the right people with the right housing services based on their level of need and their level of vulnerability. The last element is referral, so connecting those to housing and services. This is when individuals or families, veterans, right, are matched with available housing resources or services based on the community's guidelines. So the goal is to help them find a stable housing solution as quickly as possible. So by following these 4 steps, which are, again, access, assessment, prioritization, and referral, coordinated entry creates that fair and effective system that ensures people experiencing homelessness get the right support at the right time. Next slide. All right. So now let's talk about how people can access the coordinated entry system here in Pinellas County. It's really important to know where people, right, your friends, your neighbors, anyone can face homelessness at any given time. So it's important to know when they need help, where they can go, right? So coordinated entry, for one, just to reiterate, it's open to all household types, including youth-only households, single adults, adult-only households like friends or non-married couples, LGBTQIA and plus households, families with minor children. No matter their situation, people in need can connect with a coordinated entry access point to get started in this process. And there are several designated access points for people experiencing homelessness in Pinellas County, including emergency shelters, street outreach teams, First Contact, formerly known as 211, HLA's Rapid Resolution Community Navigation Team. We also have HLA Veteran Navigation. And so those specialized access points, some that I named just a moment ago, I wanted to kind of go over a little bit because we do have special access points for domestic violence survivors, such as CASA and the Haven, or Hope Villages. And those special access points for domestic violence survivors ensures that survivors of domestic violence receive safe and appropriate services. So DV shelter providers handle the initial coordinated entry assessment and then refer individuals as needed. Veterans who may be experiencing homelessness. So veterans can access special support through HLA's Veteran Navigation Team, where they are screened for veteran-specific programs, such as GPD or grant per diem programs, VA benefits such as HUD-VASH, and even supportive services for veteran families, for short SSVF. Next slide. So how we assess and prioritize people in the coordinated entry system, that's something that I wanted to touch on also. So the goal is to ensure that everyone gets fair and equal access to the services that they need. So assessments are important, right? But even more so important is that we use those shared assessment tools to keep the coordinated entry process consistent across our community. So this means that no matter where someone seeks help, they're assessed the same way and they're connected to the right resources. Our assessments focus on a person-centered approach, meaning we look at an individual's unique situation while we're making sure that the process is fair and trauma-informed and efficient. We do have different types of assessments here within our community, in our county. We have our family shelter assessment, which is a tool that helps prioritize literally homeless families with minor children in need of emergency shelter. Once completed, once that assessment's completed, that family is added to the shelter prioritization list, and they're assigned to a specialist at the HLA. This allows families to access the coordinated entry system quickly, even if they haven't stayed in a shelter yet. And then we have the coordinated entry assessment. Currently, the tool that we are using specifically at this current time is the VI SPDAT. This is a vulnerability index that helps prioritize literally homeless individuals and families for housing and supportive services. Lastly, we have a full SPDAT, right? It's a more in-depth SPDAT, it's a more in-depth assessment that's used for service planning. So it's very, very in-depth, very intensive, and it helps identify areas where support is needed to avoid housing instability and to track that progress towards housing stability. All assessments, right, including the primary CE assessment, must include trauma-informed and culturally competent questions for special populations such as immigrants and refugees, youth, people fleeing domestic violence, LGBTQIA plus individuals. And what cultural competence means, it's your understanding and responding to each person's unique background and needs. So those that complete coordinated entry assessments in our community are street outreach teams. They can be emergency shelter case managers, HLA teams, staff at SSVF, and also transitional housing on a case-by-case situation.
Suzanne?
Yes.
So sorry. We are actually right at about time for
Okay.
this part of the presentation, but I know that you have a couple of really important things that you wanted to make sure that this group knows about. So if you don't mind me asking, and of course there will be an opportunity, everybody, to ask Suzanne some more questions and to see the rest of this presentation afterwards. But Suzanne, when we're talking about these assessments, who has access to the information that we are putting into these assessments?
Great question. So the who has access, right? So we do ensure fair access for everyone, but we also ensure that all of the protected personal information is secure. So we take that privacy and security very seriously when we're collecting and handling client information. So only those that have information that have access to our HMIS system, which is a system that is used collectively amongst all continuum of cares, can have access to that information. We do not. We do not give access or information to law enforcement. There are strict guidelines and protocols and policies in place that protect those and their information that are being added into our HMIS system. But there are a lot more details that can be provided on my slide in my PowerPoint that I'm sure will be sent out to everyone.
That is so good to know, Suzanne. So really, the point of the assessments is to make sure that people are, and step in if I'm wrong, but the point of the assessments is really to make sure that people are being connected to the right services and that the folks with the greatest need are being connected to those services first. And the only people that are accessing that information are like people specifically licensed to. So it's not, just publicly available to everybody or something like that. Is that about right?
That is completely accurate.
Awesome. Awesome. That is such good information. Thank you so much, Suzanne. And please, if you have questions about coordinated entry or why we do these assessments, who has access to these assessments, what might be on these assessments, go ahead and pop that in the chat because Suzanne will be staying on with us to answer more questions afterwards. And I think that is a great lead in to our next presenter, who is Lieutenant Zach Haish with Pinellas County Sheriff's Office and Safe Harbor Emergency Shelter. And Lieutenant Haish, you can talk a little bit about emergency shelter, which is, of course, part of the coordinated entry system as one of those access points.
Okay, yeah. So, oh good, the PowerPoint came up big enough. I put it together quick and I didn't know how it would look when it came through. So for those of you that don't know, Pinellas Safe Harbor opened up, we're in our 14th year now. And it opened up as a response to the overcrowded situation that the Pinellas County Jail was going through. At the time, prior to Safe Harbor opening up, county jail was crowded, and the unfortunate response, knee-jerk response to homelessness throughout the county was for the homeless population to be arrested on ordinance violations and misdemeanor crimes and things that were sometimes unavoidable because of their housing situation. So the sheriff, the state attorney, and the public defender of Pinellas County got together and they looked at who was going to jail, why were they going to jail, and what was the downfall, and what was the reasons. So when they figured it all out, it was because of a lack of access to other shelters that was happening at 2 o'clock in the morning. That was happening on Sunday or Saturday, because homelessness doesn't happen between Monday through Friday between 8 and 4. And let me make sure that I'm not speaking ill of any of the other homeless shelters in the county. We have great relationships with them, but the whole point of Safe Harbor is that, and you can see on this slide, is that so it is a 24/7, 365 days a year opportunity for homeless adults to get off the street. The sheriff doesn't want law enforcement making arrests on the homeless population when they don't need to. This population needs assistance and services to get back on their feet. So by never closing, Safe Harbor gives law enforcement officers a consistent alternative to incarceration when it's appropriate. I don't know any other, I've been doing this, so I'll tell you about me real quick. I've been a part of the HLA for going on 12 years now. I sit on the Providers Council, and I represent Sheriff Galtieri on the HLA Board of Directors, and I've sat in a couple other committees through the years as well. Through all that, I've worked with other law enforcement agencies, jurisdictions, homeless shelters all throughout the state and actually across the country. I don't know any of the others that are cutting out nearly over $2.5 million a year to operate a shelter out of their law enforcement budget. So it's 2.6 million out of the sheriff's office budget every year to make sure that the homeless population in Pinellas County has a place to lay their head, case management, and food in their belly. And that comes out to about $34 a day. So we want to make sure that those individuals are taken care of. And the individuals that I'm talking about are, you can go to the next slide. The population out at Safe Harbor, we run just shy of 300 on average, anywhere between 250 and 300 per night. We have 400 total beds available throughout the facility. We have about 1,000 individuals walk out of the Pinellas County Jail every year with nowhere else to go. And those are the only ones, those are just the ones that tell us that they spent last night in jail, or they spent the last few nights in jail. Yeah, it's probably a little bit more, but we use the self-disclosed information in HMIS. So on average, there's about 3,500 unique individuals that seek shelter at Safe Harbor every year. I mean, when you look at the PIT count every year, we're seeing more faces than the PIT count sees every year, just at Safe Harbor alone. And that accounts for about 10,000 intakes. We're well aware that homelessness doesn't get solved the first time you access services. It doesn't get solved the first time you access shelter. It doesn't get solved the first time you decide to do anything. So we know it's going to take 5, 6, 7, 8 times sometimes for some people to get things straightened out and to be willing to work with case management. A lot of times it's rapport building, and they've got to come back 3 or 4 times before they feel safe, telling their tale to a stranger. The average age group is 31 to 50, but our rules are 18 and breathing. Basically, anybody that is over the age of 18 and can care for themselves, we're more than willing to let you come in and get off the street and give you an opportunity. You can go to the next one. So the facility, we're new intakes are accepted 24/7. Wi-Fi is throughout. Curfew's at 8 o'clock. Curfew. So 8 o'clock at night, we do a physical attendance most nights of every individual in the facility or those that are signed out to work. So we know the population works. We want them to work. So if you're signed out to work, we'll save your bed, we'll save you a plate of food, and we will we'll make sure you're taken care of. Work or school, or if anything, anything that might be approved. Intakes again are accepted 24/7, but if you're here and you're stably here, we would like you to be back by 8 o'clock at night. You get some breaks on that. We understand that you might have somebody's couch to crash on for a couple of nights, so you might go do that for a couple of nights, and then you're going to come back. We get it, we understand, and we work around those things. Access inside, everybody's got washer, dryer, ironing station, microwaves, TVs, showers, restrooms, lockers we give out. I just heard the announcement. We do lockers every Tuesday night to issue lockers so that you can keep your stuff safe and locked up, and your valuables aren't in danger of disappearing. Go to the next one. Meals. So we have a contract. I know John Paul's on here. We have a fantastic contract with Metropolitan Ministries to provide all of our meals out here. Over 300,000 meals are served out here every year. Breakfast and dinner are hot meals. Lunch is a lunch meat sandwich, bag of chips, and a piece of fruit. The sheriff didn't want anybody to question where their next meal was going to come from. So he wanted to make sure that if we're going to open this place up, we're going to do it. We want people to be around. We don't want anybody having to go out and panhandle and scrounge to where they're going to figure out where they're going to get some food in their belly from. So we make sure we serve 3 meals a day out here, that so that the residents that are here, they know they're fed and they don't have to worry about where their next meal is going to come from. The meals are served by resident volunteers. You can stay on there, that's fine. We make sure that anybody who's helping serve meals goes through a food safety training. It was approved by the health department. We make sure that they know what they're doing and they're doing it in a safe manner, and they're supervised by an employee. But we want the residents staying here to feel empowered and remind them sometimes that they are capable of doing a little bit more. Lucky for us, we have the Bayside Clinic right on the same property in the parking lot, basically, of Pinellas Safe Harbor. It is a Monday through Saturday clinic for any homeless adult that doesn't have insurance. They can go in there and sign up for the blue card and get access to Pinellas County indigent healthcare homeless plan. We've also got a social worker from the county that is on duty here 3 days a week that can do it in-house and get them signed up, and then they can go over to the clinic. Once they sign up for that blue card inside the walls of Safe Harbor, they can walk over, and they normally have a doctor's appointment within usually like 7 or 8 days. They've got an appointment set up for them, and then they can get access to the Flamingo card that's available through the Bayside Clinic or through the Healthcare for the Homeless plan. 7 days a week, there's a licensed mental health counselor from Elios that is available on site 7 days a week at Safe Harbor, which is fantastic, because for a long time it was none at all, and then we had one 5 days a week, and then just within the past couple of months we've had access to one out here 7 days a week. We would much rather a licensed clinician do a crisis evaluation rather than somebody from law enforcement. The questions and the approach is much different and a better handled through a licensed mental health counselor. Every Wednesday, except for one, I don't know which one, but at least 3 Wednesdays out of the month, the vaccine clinic through Department of Health is out here to do vaccinations for all the communicable diseases that are available out there that are able to be vaccinated against. So this slide and this keeps getting bigger, which makes me happy. We've got 6 case managers out here. We've got a vacancy right now, but we've got 2 assigned to street outreach, kind of encouraging the population that's out on the street and not taking advantage of the shelters and is in violation of House Bill 1365 by sleeping on public property to come inside, take advantage and access to shelter. We'll connect them not only to Safe Harbor, but to any of the shelters in the area or any of the detox programs, Turning Point. We just got somebody in Operation PAR on Friday. So it's not just Safe Harbor that our street outreach people are connecting them to. But for Safe Harbor, we've got all of these people out here, and it keeps getting bigger. Down at the bottom, you can see we've got a new treatment for individuals experiencing homeless grant that is coming on board as we speak. That's one of the additional licensed mental health counselors that I spoke of. It's going to have 4 intensive case managers, oversight from a director, and then peer support specialist and an administrative assistant to try to keep everything rolling. We do have security out here. I know that's a concern for some people, but it's also a relief for others. It's split. You know, some people like the security and some people don't, but it seems to be a necessary vital piece of our manpower to try to keep everybody safe out here. We don't discriminate regarding people coming in, whether they're intoxicated or under the influence. So a lot of times we have people that are coming in and you know, not so great moods. So it's nice to have security on site to help handle any situations quickly that may arise. PCSO, community policing deputies, there's one always on in the area or readily available to respond. We offer a bunch of classes at various times. They're not always going, but as they come in and as they're available, or as we have the ability to teach them, we make sure those are all taught. Because if we just had a shelter where people could hang out, not learn anything, it probably wouldn't be as productive as possible as it could be. So we're providing all the referrals in the community just like everybody else does. We work with everybody to do everything that we possibly can. We try to do everything in-house We try to send people out for as little as possible. Just to try to keep everything in. So the only things that we can't do are the DMV bus, which has become harder and harder to get out here, and the Social Security office. But beyond that, we're pretty self-sufficient and self-sustained out here through all the partners that we have. I see there's a question in the chat about taking pregnant women. As a matter of fact, we have 2 here right now. So that's an easy yes. We will connect them to all the pregnancy resources that are out there in the community to try to get them out of here as fast as possible. This is not the hopeful environment for any pregnant woman that's in the area. So we try to do everything we can to try to transition them safely and appropriately as quickly as possible. Is there another slide? No.
Lieutenant Hayes, there were a couple of other questions in the Q&A box. First of all, is Safe Harbor somewhere that a married couple can shelter together?
I know I have one married couple here right now. I don't have any cohabitation. The living areas are separate, male and female. But yeah, we have married couples here from time to time, and there's actually one here right now.
Wonderful. Thank you very much. There was also a question from fellow COC board member, Ms. Teresa Jones, asking, does Safe Harbor still limit the stays of registered sexual offenders?
Good question. Yes. So we're across the street from Bayside High School, which is within 1,000 feet. And many sexual offenders and predators have that rule. We do allow them to come for up to 48 hours. We can stretch that if we do have a housing opportunity on the backside of it. So if we know somebody can get placed somewhere or whatever, we can stretch that out as we need to. But yeah, they can come during one calendar year, and we get them set up with as much as we can in that short period of time that we're allowed to have them stay.
Thank you. I also had a question about the storage that you mentioned. I am guessing that is available exclusively to people who are staying at Safe Harbor, but can you confirm that?
Yeah, so I should have put that. Yeah. So yeah, we have 8 huge storage containers on the outside of our facility, and it's for the current residents of our facility. But the other thing we do is we hold on to it for 14 days past when somebody exits. So that 14 days easily turns into 20 sometimes because we get busy. So your stuff doesn't get discarded or donated just because you're gone for a little while. We have people regularly call us from inpatient programs. We get somebody into a 30-day program. You know, we don't want them to be worried about their stuff going. They call us from the hospital and say, hey, we're going to be here for a while. We take care. We hold on to their stuff.
Wonderful. Thank you so much. We do have one more minute. Are there any other questions for Lieutenant Hayes before we start talking about street outreach? Not seeing any immediately. If you have one, Ms. Chair Beckman, go ahead.
Thank you. I've been kind of multitasking, but listening. I had, is anyone charged to stay at Safe Harbor, like if they have Social Security and, you know, or if they have a job but can't find housing? Is there a limit to how long they can stay, and do you charge them to stay there?
We would never charge, and let's go backwards and then forwards. We would never charge anybody a dime to stay here. That would be, nope. We won't say what that would be, but no, we don't charge anybody anything to stay here. I think I just did the report a couple of weeks ago, and it looked like about 27% of our population was working. And then we probably got about another 30% has income through Social Security, retirement benefits, whatever. We connect them to all the transitional housing opportunities that are available, rooms for rent, home share, all of those things. We give people time. We know they might have bills. We understand they got to pay things off. Their length of stay is all determined by case management. We don't have a hard, fast 30, 60, 90 days on things. That doesn't solve anything. So it's all case by case.
Thank you so much. Thank you.
Yep.
Excellent. Thank you so much, Lieutenant Hayes. Really appreciate that information. And if you have any other questions for Lieutenant Hayes, please go ahead and put those in the Q&A box. Lieutenant Hayes, if you see them come through, please feel free to go in and jump in and answer them. And then I am excited to introduce our next presenter, Mr. Todd Nutbrown with the City of Largo's Homeless Street Outreach Team. Todd can tell you a little bit more about it, but Largo's Street Outreach Team, as you may have heard me say earlier, has actually received some national recognition recently for innovations in outreach. So I am really excited for y'all to hear from Mr. Todd Nutbrown. Todd?
Good afternoon. Hello, everyone. Or good evening, I guess. Sorry. It's been one of those days, so I apologize. Can everybody hear me okay?
Yes.
Okay, wonderful. Good evening. I wish you didn't put me after Lieutenant Hayes, but we'll try to keep up with the trend here. Once again, my name is Todd Nutbrown. I've been doing either running teams for outreach. I worked also with the city of Toronto. I ran their whole system. Basically, we have 119 shelters in the city of Toronto. My job was to organize those. And from there, I worked with Toronto Community Housing. And then I came to the States. I was the first one hired to develop the team in Tampa, Florida. Then I went to Texas and started their team in San Antonio. And then I was lucky enough and fortunate enough to be offered a job with the city of Largo, which I feel very blessed. Um, I think the first thing that I would say is any outreach worker, it's energy. You can have all these systems and policies and ideals. If you're not out there with the energy, folks are already struggling. Your job is to go out there and inspire, to convince, to develop those bonds and relationships. So that's my responsibility. First thing is to try to break down those barriers. I'm not a small fellow, so I sometimes have to, try to convince people that I'm there for them and that I'm not another officer. I kind of have that look. So that's kind of my first thing is that first impression. I always call it planned and strategic connectivity. We have to do it in a strategic way. One, to build those relationships and bonds. Two, it's definitely to be able to understand the system, how to navigate that. That's basically what I am, is a navigation. I think any other outreach worker would say that. Sometimes you get into case management depending on the complexities, but my job is basically to know the programs and services in Pinellas County and to assess the individual for suitability. But I only do that with a strength-based approach. I don't always look at the barriers. I look at what this person is good at, what they're going to excel at, and build on that to build up their self-esteem. So I think I can bring people along pretty quick because they see that I'm trying to build them up, not just designate them to somewhere. I'm also looking at efficiencies there. I'm going to start because I'm new to the city for about a year and a half. And kind of the steps that we've put into place for me coming in as the only homeless outreach specialist for the city of Largo. I work with housing under Arrow, Woodard, but I'm also under Sergeant Dulski and the police department. I'm actually housed in the police department. So I have a unique perspective. I was a federal correctional officer years ago, so I kind of have a little bit of understanding of what, policing looks like in that sort of realm. But I was more angled at the social work side, so that's kind of why I went in the direction I did. You really have to understand the city you're in. Everybody's the same across North America. I don't care what city, what place you go to. Humans are humans, but there are idiosyncrasies in every area. A great example would be the nomadic nature of the homeless population or unhoused population in Pinellas County. They could be in St. Pete in the afternoon, and by the evening they could be in Largo. So people are very motion. Everybody's in motion. So you have to take that into context of how we serve these folks. You try to serve the folks, I'm responsible for Largo, but at times, you have to think outside the box. There's definitely a gray area in trying to support some of these folks that maybe would have been in Pinellas Park, but are now unhoused in our city and that sort of thing. And the other part was, we always, officers have a certain job. And once you understand that, you understand, okay, this is where the barriers are to the housing piece or the social work piece. So what I bring with the team is kind of conceptualized ideology, thought process for best practice. I've worked everywhere, and I'm 1,000 years old. So some of these things that you see work over and over and over again, that's just not a hypothesis. That's active learning or learning on the fly. So what we've done with the police department is we've done sessions with each officer in groups to kind of and I'm very blessed because Sergeant Dulski, if anybody knows him, he's a very compassionate person. You know, he still does the policing part, 27 years, but he also has a real heart for the unhoused population. So, you know, he brought along, and he and I have got to educate the rest of the police department. Now you see that in that slide that Officer Melandro, he's the officer in charge of the outreach. He's out there working every day, sending me referrals. And also Officer Stamper. Those two gentlemen help me kind of, they're my fingers out there. What we have to remember about officers is they're out 90% of the time, and there's a heck of a lot more of them than there is of me. So they're a great tool to bring people to me that I can access and try to, convince and do that work to get people where they need to go in the services in the community. So, when you talk about community partners and people that are there, the first community partner I had are the people around me. I got to make sure that our group is efficient, that we're all on the same page, that they actually see that what I do can make their job, enhance their job and what they do, and make their job easier. That's what I'm there for. I'm there to, instead of them having to trespass a person 85 times in front of numerous, properties and that sort of thing, businesses and private, I'm there to kind of give them those options and build them up so they'll take an option outside of that. So, we do have a big component in the city of Largo that, feedings, those things are there. But what we want to do is actually lift people up and actually want to go to a program where they can get back on their feet and not just, look for the next meal, but actually thrive. I want to see people thrive and get to there. So that, we have that dichotomy. We're always working in that, trying to work together. One of the biggest things for me was understanding what is the history in this area of the unhoused population and what programs and services. I work with the HLA in Texas. I've worked at HLA in Hillsborough. It was called Sarah in Texas. So I got a good feel for what these lovely folks do and what their mandate and what they're trying to do. And I try to make my work in conjunction with what they do. Sometimes, we have to react quickly and we have to be creative. So what we've really developed is we have a list of all the community programs and services. And I'm better to explain what we do in an example. Here's a great example the other day. We have an individual who doesn't want to be trespassed anymore, finally says, I'm ready to move on. What can you do for me? Well, I meet him in the road. I look him up on HMIS, which is the database system, and I see, wow, this guy's been everywhere. This guy's been for 12 years bouncing around our system. So what I start to do is look, okay, housing isn't the biggest barrier here. What is the barrier for this individual to be successful? So as we get into more conversation, they get to know me, and maybe it might take 2 touches, but hopefully 1 touch. That's what we call, a lot of folks call in outreach work, touches with people to make contact and get to know them, and then for them to get to know you. What we found was this individual definitely had an addiction issue that, it was a secret. He liked to keep it quiet. It was obvious in the way he was living and some of the, the nonverbals and things that were going on. So we looked at the complexity of that, and I said, okay, well, we have to work on on this addiction. Are you ready to face this? And they were like, yeah, I think so. I said, well, you call me back tomorrow and let me know if you're really ready. You can go to Safe Harbor right now. It'll get you off the street. The officers won't bother you. And then give me a call tomorrow and we'll work on that. So that individual went to Safe Harbor. They called me the next day and said, yeah, I'm ready. So I went and picked them up and drove them to Operation PAR, which is a medically assisted rehab and detox here in the area. Took them over to the facility. And the other part I'm going to bring in here that's very important with outreach workers is developing the bonds and relationships with the service providers. Instead of calling on a regular number, I actually bypass that and get to know the folks that are behind the scenes that we can get access to. Sat with the individual. We did the over the phone interview, screening, then transported them over to the facility, which I got lucky. It was that day they could take him. Got him in there. So he was there for 7 to 10 days. He graduated from that program. I worked with their case manager. So here's the case management side. We're not supposed to case management, but you get into it. And then I made sure I went to pick them up, transport them to another program in the area called HEP, the Homeless Empowerment Program, where we have 20 beds. The city of Largo, we purchased 20 beds, 4 female and 16 male, and transported them over. I didn't let them get over on their own because they might have gone and seen their old friends that helped their habit on the street. So I make sure they get there directly. And then once we get there, I help them with the intake with those folks, and then from there they go into that program, and that's a rehousing program. I mean, it's a shelter, but I think a lot of folks here that know me, if they've seen me anywhere, I make sure that I don't refer to anything as a rehousing or as a shelter. I try to change the verbiage and say it's an opportunity and it's a rehousing program. If you work the program with your case manager, you can get rehoused because successes are happening all the time. It's up to you and you can do it, you know. So we get them in there, and this individual, this was probably 2 weeks ago. They have now at HEP they had they worked on his dental. They have a free dental office there. They worked on this individual's um, aptitudes for work, so his resume, and now he has a job with one of the gas stations in the area. So he's building up that sort of capacity and just small steps, and then all of a sudden he's found some faith, which was great for him. That's what I think what he needed to help him be strong, and then from there he just worked on into hopefully we'll have him rehoused in the next 2 to 3 weeks. They're working on that with the housing navigation now. So that's just an example. And another big important part with Lieutenant Haitian and Safe Harbor is that's a low barrier shelter. So we can get somebody off the street quickly. I don't have to wait for an intake. I don't have to wait. Like you said, homelessness doesn't happen just on the work days. So it helps me get that access to where they can go somewhere where they can get a meal, safety, a little, stability, and then be ready if they need to stay there or if they can transition to another program if that's what works for them. So that's kind of an example of how the system works. We used to, when I was started, it was like, okay, we just need a housing program. All they need is shelter, get them off the street. I think now I've years of doing this, you look at the complexity of it. Okay, what are real barriers here and how can we get rid of those and move them out of the way and work with the individual so their strengths are being accessed, not just their weaknesses or like you would say, addiction. So I think that's a real big part. The city has really enjoyed that kind of approach. And I think other service providers have too. I would never go to Safe Harbor and just dump someone. I would try to make sure that we have a plan. So that's the kind of the case management without being a case manager, but you kind of roll into it every once in a while. So my job, last month I had 950 calls. And I had about 170 emails, or sorry, texts. That was just on my work phone. Then you get emails and stuff from the officers and that sort of thing. So that's the other ones on top of that. We are supporting around 50 folks a month, somewhere around there, between 40 and 50 folks a month, trying to access programs and services and getting them into intake. I mean, obviously not everybody shows up for intake, but we give them the opportunity. And we don't give up on that. We'll give them another crack at it. Obviously we're with Safe Harbor, a great bunch out there, always support me really, really well. Pinellas Hope, always a great program, great case management, good management. Just enjoy that access to that program. And that's every Tuesday at 7 a.m. Is their intake. And then we have, we use HEP a lot, the Homeless Empowerment Program, because obviously the city has purchased some beds through there. So that's another access program where we can work them through that program and hopefully get them rehoused. And we're having some really great outcomes in all these programs. The other part is obviously the medical facilities. We do get a lot of calls from folks that are struggling in medical facilities. So we're there to kind of support those folks. If it's a really complex discharge, we try not to do that too much. We try to, let the case management at the hospitals do that sort of thing or medical facilities, but we are there for them if there's some complexity and we can help somebody. I'm a little bit different. I have a lot of street experience. I've worked in a lot of cities where they don't really baby you. They just say, get out there and do it. And so the one thing that I have is I have a radio, so I'm connected to the same dispatch as the officers are. So they know when I'm out of my car, if I'm transporting someone. So it's all time stamped. So they know where I am, and they'll do their wellness checks and make sure that I'm okay. So that's a little bit of a different aspect than I would have than maybe some communities. I love that because I like to have that freedom to be creative and meet people where they are. I don't go in the woods deep and by myself, but I have the ability to go anywhere I need to go. And then all of a sudden we have what's the other one here? Sorry. Uh, and also the access to email. It's on our website that folks can get a hold of me. And then obviously we have calls, emails. We have our own email site for the homeless division. So we're all over the place. So if anybody has any information or needs any information or wants to know more about what we do, I mean, obviously you can get a hold of me at homelessoutreach@largo.com. And I will get back to you as soon as possible. And if you have anybody in the community that you see that you feel you're in the Largo area or right around the Largo area and you see someone and you just want to help, you definitely can get a hold of me at any time on that email, and I'll get back to you. The other one thing I want to add, effectiveness in what I do is responding quickly. I don't wait 24, 48 hours. I make sure they know, even if I can't help them at that minute, I got you. I got your information. I'll get back to you as soon as possible. So I don't think anybody feels like I left them for 3 days. And I'm getting great feedback on some of the questionnaires that we send out that, just people want to be heard and felt that somebody's listening, I think is important in our system. And sometimes that can be an area that's left, a little short. So just my 2 cents on that one.
Thank you so much, Todd. That is such awesome information. If people are experiencing homelessness in Largo, just so we can be 100% clear, is the best way to reach you and your team the homelessoutreach@largo.com email?
Yes, I mean that's always. I mean that's constantly. I'm checking that, and other folks. It's connected to a few folks, so just in case I miss it. Um, so yes, I mean that'd be the best way. And I mean if you want, a face to face or to want to chat over the phone, just go in there and I'll get a hold of you and give you the information, or you can give me your number and I'll get a hold of you right away.
Awesome. Thank you so much. That is such amazing information. If you have questions about street outreach in Largo, or if you want to be connected to some resources in Largo, go ahead and drop information in the Q&A box, and we will make sure that Todd here gets that. And of course, we'll still have a little bit of time at the end for more questions. Before we move on to our presenters with first contact, we have a little bit of an addition to our agenda here. I'm really excited to say. Mr. John Paul Comas with Metropolitan Ministries Street Outreach Team is also on the line with us. And he's going to take just a couple of minutes to talk about what Metropolitan Ministries does, which is very similar to the kind of outreach that Todd does with the City of Largo. But Metropolitan Ministries does it in some different areas, and they have some different services as well. John Paul?
Thank you. Thank you. Hopefully you can hear me okay. And I appreciate the time on the agenda. And I follow Todd's sentiment. It's hard to follow Zach and Todd. So thank you for this. I'm John Paul. I represent the Metro Brigade at Metropolitan Ministries. Our street outreach team is in Hillsborough, Pasco, and Pinellas County. We're new to Pinellas County, so we are finding our feet in the area, in the territory, and we offer a lot of the same services and processes that Todd had outlined. But I want to talk specifically real quick about the brigade services that are, and I appreciate Todd sharing the stories. I think client stories really connect us to the work that we do, and those successes are so important. And it also shows the importance of partnership and relationship. And I think that is such an important part of any COC. So I'm glad you highlighted that, Todd. So what I'm going to talk about just very quickly is the specific services that we offer as street outreach. And these services are available to any of the clients that we serve at any location, whether that be the sidewalk, in an encampment, at a meal site, at a shelter, a library, anywhere we can access Wi-Fi, and we bring our own hotspots. Anywhere we have the ability to meet with somebody, we can offer any of these services. And that is access to HMIS, getting folks entered into the database. We can help with food stamps, identification assistance in the form of a voucher for a Florida state ID. We can help clients and pay for their birth certificates if they don't have that. If that's a barrier to identification, we'll order that from wherever they were born and make sure that we get that and upload it into HMIS for future use if once we get it. We also help with SOAR, which is SSI, SSDI, outreach, access, and recovery. That is the fast track for Social Security determinations. We offer referrals to meal sites, drop-in centers, shelters, of course, and being the access point to some of those shelters. Family reunification assistance. We can also, if someone has family in another location, another area of the country, even out of the country, once we have vetted the family member and all of the information that we can to make sure that the individual has a safe place to land once they arrive, we will help them get to that family member to end their homelessness as soon as possible. We also help with employment assistance and referrals. Any service, again, that we can offer, we can do anywhere we are able to get access to that individual that needs the help. And I think some of the characteristics that Todd pointed out, I just want to highlight for street outreach. The importance of it is that consistent presence, a non-judgmental approach, culturally competent staff, respecting the autonomy of the client, making sure that they're in control of what is happening. Complete transparency, no secrets, nothing is done without the client's input and permission. We provide immediate assistance in the way of hygiene, water, food, whatever we have available to help folks in the moment so that they can be open and available and with a clear mind to make choices. We offer resources, we empower clients. And actually, as I say empower, I'm trying to take that word back a little bit, not use it so much, because something I heard recently is that when we use the word empower, it sounds like we're giving somebody something. And we want to embolden folks, not necessarily give them the power that they already have. We want to remind them of that. So that's how I'm trying to restate that. And then follow up, as Todd mentioned, the importance of reconnecting with somebody, doing the things that you say you're going to do, and making sure that there is opportunity for follow-up. I know that there may be questions about street outreach, and I'm happy to answer any, but again, I didn't want to take up too much time, but wanted to come on and see you all and share what the brigade does. And currently we're in Newport, I'm sorry, I'm in Pasco County right now. We are in Tarpon Springs. We are also in St. Petersburg and Clearwater, and looking for, of course, other areas. And those are, of course, we're sensitive to the geographic areas of Pinellas County. So just making sure that we're in areas that we're needed. So thank you.
That is wonderful. Thank you so much, John Paul. Really appreciate you coming in and sharing that information. If you have questions for John Paul, please don't hesitate to put them in the Q&A box as well. Metropolitan Ministries has added some really, really awesome services to our Pinellas community over the last, I want to say 2 years, but I have a bad sense of time. So we are very grateful to their presence and to their partnership, for their partnership. Now I would like to introduce you all to Sasha St. Felix, 211 director with First Contact, which you may, like me, still sometimes call 211 Tampa Bay Cares. Miss Sasha, would you like to say hello?
Yes. Hi, everyone. So today I am going to focus on the homeless helpline. However, we have other programs at 211. Do you mind going to the next slide, please? All right. So First Contact, we are split into two departments. So there is a 211 department and 988 department. So the 211, we have a 211 program, that provides information and referral. As I mentioned, we have 988, which provides suicide and crisis intervention services. We have other programs like the Homeless Helpline, the Veteran Peer Support Program, First Responder, the Family Caregiver Line, and so forth. There are many other programs. In regards to financial assistance, we have the Adult Emergency Financial Assistance Program, the United Way Fund, the Duke Here to Help Fund, available for those in need. Next slide. Okay. All right. The Homeless Helpline is funded by Pinellas County Human Services in partnership with the Homeless Leadership Alliance. And First Contact is a screening entity for the Homeless Helpline. The Homeless Helpline is operational Monday through Friday, 8 a.m. until 5, and it's staffed by 2 agents that answer the calls full-time between those hours. And what we screen for, we add families to the shelter prioritization list. We also discuss diversion services, and we provide information and referrals. So last year, we received about 5,000 calls for families and 6,000 calls for individuals that were seeking connection to shelter services. All right, so what you're currently looking at is a flow map for what happens for calls received during business hours and calls that are received after hours. So during business hours, our specialists, they have conversations with the callers to identify their needs. They explore past experiences and risk factors. They also collaborate with the caller to consider various and immediate housing solutions. So this includes relocation assistance, their natural supports, services outside of Pinellas County. We also talk about diversion programs and so forth. For those households that meet HUD's definition for Category 1, we discuss shelter options. And for those that do not meet the category, we provide information and referrals. And we also explore eligibility for other programs that we have within 211. For those that meet HUD Category 1's definition, we collect some additional information that is entered into 211's database and also into HMIS. So for individuals that are seeking shelter placement, we, depending upon the situation, let's say there are some barriers where they're unable to reach out to the shelters themselves in order to coordinate services, our specialists reach out on their behalf to these shelters to coordinate services for them. For HUD Category 1 families, we set an appointment with HLA's community navigators for a coordinated entry assessment, and those are scheduled through Calendly. Households that are interested in engaging with HLA services or are unable to go to a shelter for one reason or another, we complete a HLA e-referral or a WUFU form on their behalf. Depending upon the need identified during the conversation, we may reach out to street outreach to advocate on their behalf as well. And after each conversation, we provide suitable referrals based upon the conversation we've had with the person. For calls that are received after hours, we provide them information and referrals, and we encourage them to call back during business hours to be screened by the Homeless Helpline. Now, for families that are doubled up with a leave date, we complete a HLA WUFU form. So we talk about diversion services with them. We do the same for families that are staying in motels. And for families that are facing eviction, these are families that are not HUD Category 1. So for families that are facing eviction and they are sustainable and their landlord is willing to accept payments from a third party in order to stop the eviction, we do discuss FSI, FSI Connects. Next slide. Questions? Are there any questions about the Homeless Helpline? All right.
Awesome. Thank you so much for that, Sasha. That was really, really informative, and very much appreciate you. Are there questions for Sasha about 211 and resources that you can be connected to through First Contact? No? Okay. Do we have other questions? So going back to Ms. Suzanne Boylan talking about coordinated entry and those assessments, Lieutenant Hayes talking about Safe Harbors Emergency Shelter. We also had, of course, Todd and John Paul talking about street outreach. And then Miss Sasha talking about the homeless helpline and resource connections through 211 First Contact. Do we have any questions other than what was asked already? I'm going to take one. I did my best to answer this question in the chat, but Sasha, you might be able to answer it better than I can. One of our participants is asking about shelter for married couples that do not have children. And do you know where we might be able, or where in Pinellas County might provide shelter to married couples without children?
So married couples can go to individual shelters. And so if this person were to call in, we would provide them information for individual shelters, or that information is available on our website. So our online database is available as well through firstcontact.org. And if the person needs coordination, meaning that they need someone to advocate on their behalf, we have the homeless helpline specialists that are willing to reach out to these shelters to coordinate placement on their behalf if this is needed as well.
Can I give a crack at that for you?
Please do.
Yeah. So there's verbiage again. I refer to them as rehousing programs and not shelters. Just because of the case management piece and getting people to buy into that. Just it's not a roof and a meal. It's your future. I'm always about verbiage. It's how we say things, and I think everybody else here can understand that. So the facility that actually where couples can stay is Pinellas Hope. They can cohabitate in the same tent or the same cabin cottage. They have cottages there that you can purchase for $200 a month to stay in in an air conditioned cottage. So that is a facility where it's very as long as you have the paperwork for your pet, your dog, it's an emotional animal. That's very important. That's one of the facilities, but make sure you have you'll have to have information on the shots of the animal and that the animal is actually designated as a social emotional animal. And also couples can cohabitate in the same tent or the same, environment or location together. Other programs usually, have males and females separated, or example would be HEP. There's two different dormitory areas, so they're separated into two different dormitories. So yeah, so Pinellas Hope would be your choice if you needed to cohabitate together and wanted to be in the same area over the night or evening hours.
Wonderful. Thank you so much. I really appreciate those responses, Sasha and Todd. Very helpful. Do we have any other questions for our presenters today? While you're maybe thinking of questions, are there any resources that you would like to share? We do have a few minutes, and I love learning about new resources. That's part of why we do these sessions. And I would love to hear if your organization has a resource that you want to share, or maybe if you as a client accessed a really cool resource lately that you think other people should know about. Please go ahead. You are welcome to just come right off mute. You don't have to raise your hand. You can drop something in the chat. Go ahead and share. I'm not hearing any. So I'm assuming that means that everybody's going to send me like a really cool flyer via email later. Just kidding. But really, if you do have one, please send it to me. I love to share them. So not hearing any other questions or seeing any additional resources, I want to take this opportunity to, again, thank all of our presenters for being here today. I really appreciate your participation. Also, I want to let you all know, oh, there is a question. Hold on a second before I get into that. We have a question about rental assistance. Kristen, if you'd like to come off mute, you can go ahead and ask that directly. If you'd prefer to type it in the chat, you're also welcome to.
Sorry, I couldn't get it off mute.
That's okay. Go ahead.
Okay. So 211 would have resources for rental assistance. Is that right?
Yes, we do.
And do you know how many months they're able to help out with?
So the programs that we have in our database they provide assistance with past due rent. So are you
Right.
looking for programs that pay multiple months of past due rent? Is that what you're?
Right. Yeah. I was wondering how if there was a cutoff of how much you owe, that they
Right. So
will only
there's
pay up to a certain amount, or
right. So for certain programs, there is a cutoff as to the amount they're able to provide, but there isn't a cutoff as to how many months you're behind, if that makes sense.
okay.
So, for example, the Adult Emergency Financial Assistance Program, there's a cap of $4,000. So anything outside of that, the program wouldn't be able to assist.
Okay. How many organizations are there within 211 that have rental assistance right now? Do you know?
We have over 5 programs listed in our database that provide financial assistance with rent payment.
Awesome. Great. Thank you.
You're welcome.
Thank you for asking. That's a really important question. There might have been other folks on the call that were wondering about rental assistance, so thank you very much for asking. And if you have a question, please don't hesitate to come off mute or type it in the chat. Just let us know. So thank you very much. I have put a couple of links in the chat, so please feel free to grab those. We will also send them out with the recording and slideshow from today as well. But there are a few extra links in the chat, so you can access information from today's presenters, and so that you can find some of the other things that were shared, like the Healthcare for the Homeless program or St. Pete College's RISE program. So those are available there in the chat. Our next CoC membership meeting will take place in May. It is going to be Tuesday, May 13th, I believe. So please make sure that you join us for that event. We will also have 3 additional information sessions this year. So please make sure that you join us for those as well. We are doing them quarterly, all virtually. So join us in a few months. Tell your friends, make sure that they come along as well. And if you have anything that you would like to share that you think should be shared during these sessions, please let us know. Please also, Megan, if you could show the CoC membership page. Please also go ahead and, if you haven't yet renewed your membership for 2025 for the Pinellas Continuum of Care, go ahead and do that now. Joining the CoC gives opportunities to serve in councils, committees, to, if you're an organization, present at sessions like these, things like that. So please go ahead, join the CoC or renew your membership now. Reach out to us if you have any questions at all. And if there are additional questions, please go ahead. My email and Megan's email are in the chat or in the on your screen. Reach out to us, share your questions. We will pass them along to the presenters to make sure that they get answered. So please, thank you. Please come back, see us again. Thank you for joining us tonight. And I hope that everybody has a wonderful rest of your evening. Thank you all.
Thank you.
Thank you so much.